I'm Donna Blanchard, and this is your ThinkTech news for Monday, March 30th, 2015. The prosecutor working on the Germanwings Flight 9525 investigation has uncovered evidence that Andreas Lubitz had been treated for suicidal tendencies in the past. Christoph Kumpa, spokesperson for the prosecutor's office, said investigators have not found any writings or conversations where Lubitz shared his motives or confessed any plans. However, medical records reveal that Lubitz was suicidal at one time and underwent psychotherapy. This was before he got his pilot's license. Lubitz is the co-pilot who is believed to have locked the pilot out of the cockpit last Tuesday and proceeded to alter controls, which caused the plane carrying 150 people to crash into the French Alps with such velocity that there were no survivors. Lubitz passed his annual pilot recertification medical exam in the summer of 2014, but the exam only tests physical health. A European official familiar with the case said that Lubitz has visited an eye doctor because of vision problems and that the doctor deemed him unfit to fly because he determined that the problem was psychosomatic. Lubitz told a neuropsychologist that he was too stressed with work. It's unclear when these doctors were visited. A Dusseldorf clinic said that he had gone there twice, quote, concerning a diagnosis, but that clinic said that they had not treated him for depression. Christoph Kumpa said the speculation about Lubitz's mental state is based on a letter found in a waste bin in his Dusseldorf apartment. Airline officials said that if Lubitz went to a doctor on his own, he was required to self-report if he was deemed unfit to fly. Saudi continues to lead a coalition of 9 countries in airstrikes against Shiite Houthi rebels who have captured key parts of Yemen. The conflict splits the region along religious lines, with a predominantly Sunni coalition that includes Saudi Arabia, the United Arab Emirates, Kuwait, Bahrain, Qatar, Jordan, Morocco, Egypt, and Sudan. The Shiite Houthis are aligned with Iran. Saudi Arabia has accused Iran of boosting the Houthis' weaponry, and Iran has sharply denounced the Saudi-dominated intervention in Yemen. Both Saudi and Egypt have spoken about readying troops to continue the campaign on the ground. Houthis are battle-hardened guerrilla fighters and have already threatened suicide bomb attacks inside Saudi Arabia. Yemeni Foreign Minister Riyad Yassi said he expected coalition troops to be in Yemen within days. That coalition's campaign has been dubbed Operation Al-Hazm Storm. In Arabic, Al-Hazm means decisive or determinate. The airstrikes have thus far targeted Houthi military posts and weapons depots in the capital city of Sana'a, but Yemen's defense ministry reported that a Saudi airstrike hit Al-Mazraq, a refugee camp in Harad, near the Saudi border, killing at least 40 internally displaced people and injuring 250. More than 80 people in Scott County, Indiana, have tested positive for HIV since December, most of these in the last few weeks. Those infected range in age from 20 to 56, and almost all of them live in the small rural town of Austin, 80 miles south of Indianapolis. It's believed that the outbreak, which is the worst in Indiana's history, has been caused by intravenous use of the prescription painkiller Opana. Governor Mike Pence declared a public health emergency in the county. Opana is a powerful opiate that has become popular for recreational use in rural America. Prescription drug abuse now leads to more deaths in the United States than heroin and cocaine combined, and rural residents are nearly twice as likely to overdose on those than people in the big cities, according to the Centers for Disease Control. In Scott County, Indiana alone, at least 9 people have died from prescription overdose this year. I'm Donna Blanchard, and this has been your ThinkTech News for Monday, March 30th, 2015. Ahui ho.